A stroke occurs when normal blood supply to the brain is interrupted, preventing brain tissue from getting oxygen and nutrients. Pain is one of the most poorly understood complications after a stroke. It's also commonly underreported, underdiagnosed, and undertreated. Yet it's estimated to affect about 30 to 40% of stroke survivors. Patients often lack information about post-stroke pain and may stop treatment too early. General symptoms of post-stroke pain include numbness, tingling, burning, aching, decreased range of motion, and a change in skin color. Certain characteristics and behaviors have been identified as risk factors for developing post-stroke pain. Being a woman and having had a stroke at an older age. Alcohol use, statin use, depression, and peripheral vascular disease. Post-stroke conditions such as spasticity, reduced upper extremity movement, sensory deficits, and survivors of ischemic stroke. Let's take a look at the different types of post-stroke pain. Central post-stroke pain is a chronic painful condition that typically develops 3 to 6 months after a stroke and affects 7 to 8% of stroke survivors. It's a constant pain caused by an injured pain nerve and is described as a burning sensation or aching or shooting pains. The entire pain system acts as a nerve ending, and sometimes just a light touch can cause an intense episode. Headaches in stroke survivors are not well understood and can affect between 6 to 44% of stroke patients. Most are tension-type headaches, are moderate to severe, and can become chronic in nature. Spasticity is a common condition after a stroke, affecting 25 to 43% of survivors. Muscles can become stiff, tighten up, and resist stretching. This results in spontaneous, painful spasms and night cramps. Sometimes the muscle tone becomes so reduced that joints like an arm, hand, wrist, or toes get stuck in one position. This is known as contracture. About 60% of stroke patients experience contractures, which can make activities such as grooming, dressing, standing, and walking difficult. Shoulder pain may also be experienced after a stroke. During the first year, it can affect 1 to 22% of stroke survivors. Shoulder pain can interfere with recovery, slow rehabilitation, and cause significant distress. Diagnosis of post-stroke pain include clinical history and physical examination. Patients must report symptoms in 3 of the following 4 pain categories: increased sensitivity, skin color changes, asymmetrical sweating on different sides of the body, and decreased range of motion. They must also experience continuous pain on the affected side following stroke. Treatment of post-stroke pain includes several different options. Physical therapy can help stroke survivors relearn simple motor activities such as walking, sitting, standing, and lying down. Occupational therapy, which involves exercise and training, helps stroke survivors relearn everyday activities. This includes eating, drinking and swallowing, dressing, bathing, cooking, reading and writing, and using the toilet. The overall goal is greater independence. Botulinum toxin is an injectable treatment that temporarily relaxes stiff muscles after a stroke. Applying electrical currents through electrodes placed on the skin can reduce pain signals. This can include deep brain stimulation and motor cortex stimulation. Appropriate treatment depends on a number of factors, including the severity of the stroke and the type of pain experienced. Treating post-stroke pain with prescription medication has generally not been very effective. Their use should be tailored to the patient's needs, their response to therapy, and any side effects. Surgical treatment for survivors who have damaged nerves after a stroke can reduce their pain by 50% or more. The appropriate treatment depends on a number of factors, such as the severity of the stroke and the type of pain. The most important thing you can do if you experience post-stroke pain is talk with your healthcare professional. Keep your follow-up appointments. Follow the recommended treatment and management. Talk to your doctor before making any changes. And make it clear that the pain you are experiencing only started after your stroke.